Hello everybody, welcome back to my channel. So today I'm going to be talking about how to deal with anxiety and depression in college, in nursing school, and just in school, or even you can apply these tips to your daily life. So I've been dealing with anxiety and depression my whole life. The time that it had its biggest impact on me was my first panic attack that I experienced my sophomore year. I was just laying in bed in my dorm, not thinking about anything particularly stressful. I literally felt this overwhelming feeling of like death. I thought I was dying, and I jumped up out of my bed, I grabbed my phone, and I just ran. I ran out of my room, I ran out of my dorm, called 911. By the time the ambulance came, I had started to come down from it, but I was still just like, something has to be wrong. Like, what caused that? So I went to the hospital, and the doctor told me it was an anxiety attack. It was actually helpful in a way, because once you put a name to something that you've been feeling for a long time and you didn't really understand it, it's not as confusing to you whenever you feel it the next time. It's easier to know and to say, okay, this is anxiety, this is depression, this is what is happening, this is what I'm feeling. Now, I've tried different medications to treat my depression and anxiety. If you want to know about the medications I've tried, I can let you know, but medications work differently for everybody. Why am I particularly talking about depression and anxiety in college? Well, these type of disorders tend to manifest whenever you're in transition periods of your life. Very stressful times, such as starting college, starting a job, having a baby. People who have had depression and anxiety their whole life maybe didn't know, or maybe it was flying under the radar until you get to these transition periods and your mind just can't handle it, and you start to see these symptoms of depression and anxiety that you didn't know you had. But you are not alone. This happens to so many people. Now, I have a psychology degree, so I've studied all of these disorders, and college is hard because, like I said, you're becoming an adult, you have all these new responsibilities, you have a lot of new academic responsibilities. It's nothing like high school. You have all these classes, and you don't have anybody in your corner telling you or forcing you to go to class or forcing you to do homework. You just have to be your own motivation, and that is very hard. No one is forcing you to be in college. So you have all these academic responsibilities, and then add that to the freedom you have to go out and party and drink and start new intimate relationships, the pressure to join new clubs and groups, to belong somewhere on campus. All of these factors contribute to depression and anxiety or other disorders manifesting during this time. After you admit that you have depression and or anxiety, you can begin to accept it and know that it doesn't define you. It's just an inconvenience that you have to work a little harder than people who don't have it in order to function, in order to overcome. The best thing you could do is arm yourself with the tools that you need to fight it whenever it does appear. So I'm going to give you some tips that helped me with my depression and anxiety during college. So my first tip for you is you have to be kind to yourself. And when I say that, I mean sometimes you have to know that it's okay to step back. Step back from your responsibilities for a moment. Step back from other people. Step back from who you think you are supposed to be. Don't force yourself into something that you are not ready for. Sometimes it gets too hard to talk to people. These are the times that you need to take care of yourself. Forcing yourself to go out and be the social butterfly is likely only going to make things worse. Some days you just have to know that this is bad right now, but tomorrow it will be 100 times better, or maybe even in an hour from now it will be 100 times better. Get through those moments, that peak of anxiety and depression, and once you get through the peak, you can only go down from there. It's only going to get easier. So my second tip, sometimes it's okay to step back, but sometimes you want to reach out. whenever you're feeling at your lowest. And you can be selective with who you reach out to because you only have so much energy. You need to remind yourself that. So maybe you have just gotten through a day of classes and you didn't talk to anybody in class and it was a miserable day. But guess what? You're done with class now. You don't have to talk about your depression or anxiety. Just talking to somebody, it helps. Being social, it does help. Even though it's hard to start whenever you're feeling so low. You can't spend forever in solitude. Anxiety and depression is not one of those things that you can overcome all on your own. When I'm depressed, I have this way of pushing people away. And that's not good because that just creates a cycle where once you are in a better mood and you do feel like hanging around people, you start thinking like, well, I already pushed these people away, maybe they don't want to hang out with me now. So that just isolates yourself even more. And whenever you do have these bad days and you talk to someone, sometimes they turn your whole mood around. Just talking to someone, it makes you feel accomplished. It makes you feel like I conquered that. I can conquer anything. I pushed through a low moment and I reached out to somebody. Sometimes you lose people along the way because some people need that constant reminder that you're friends. They need to talk to you every day. But some friendships aren't going to work out and you have to be okay with letting that go. It's not your fault. Your health takes precedence and the true friendships will remain. The true friend will give you the space that you need to continue your friendship. So another tip I have is to keep yourself busy. An idle mind is not good for the anxious or the depressed. Make a to-do list every day if you need to, and try not to overestimate how much you can do because then that tends to feel disappointing whenever you can't accomplish everything on that list. So keep it simple. Consider how much time these tasks are going to take you and how much energy it's going to take you, and also put in time for taking a break. Something you can do to make the process less painful is to plan something fun on the weekend, like going to the movies this weekend with best friend. Then you have something to look forward to every day during the week. If you have a plan, you're less likely to spend so much time thinking about your anxiety and depression. If you sink into this place, the sunken place, don't go there because it's hard to bring yourself out. So completing tasks on your to-do list and crossing them off is all an exhilarating feeling. Feeling accomplished is going to help you come out of that depression or out of that anxious state. Another tip I have is not to fall in the habit of missing class all the time. When you do come back to class, you're lost, you're anxious because you don't know what you've missed. So the same thing goes for procrastination. Think of it this way. Do you want to be a tomorrow person or a today person? Tomorrow people say, I don't really feel like doing this paper tonight. I'll just do it tomorrow. I'll wake up refreshed. I'll have more time. It'll be easier tomorrow. Tomorrow is the day. I am a tomorrow person. No, don't be that person. Be a today person. Say, why wait when I could just do it? Then I don't have to worry about it tomorrow. When you are a tomorrow person, that's a whole day you spend worrying about this task that you're going to do tomorrow when you can just be doing it now. And then tomorrow, you don't have anything to worry about. The hardest part is starting. Becoming a today person and not a tomorrow person can do wonders for your anxiety and your depression and make you feel overall more productive. These tips have more to do with your health in relation to anxiety and depression. Make sure you're getting enough sleep. Another thing is to exercise. Exercise works wonders for anxiety and depression. There's research that shows that regular exercise is as effective as depression medications to treat depression and anxiety. Exercise, sleep, eat healthy. The more healthy you eat, the more you pay attention to the nutrients you're putting in your body. It gives you more confidence, which helps to combat that depression and anxiety. It's kind of similar to That feeling you get on New Year's and on birthdays, like you get a start over. You get to press a button and start over on this special day. You know, making a big change in your life, you feel like you're starting over. And that's motivation for you to get going and to stay on track. You don't need to wait until the New Year's to do it. You can start it today. Another tip is to go to therapy. I have been seeing a therapist regularly for a long time now. I don't know. Maybe like 4 years. But I saw a therapist first when I was a teenager, maybe like 13. My parents sent me because they picked up on the signs of depression, which a lot of families don't pick up on it. So you should seek professional help. There's nothing wrong with it. Society has created this stigma against mental illness, against seeking help, but in fact, most people statistically experience these problems. Depression, anxiety, it's so common. There's no reason to feel shame about seeking help. You're seeking help right now just by watching this video. So what if you haven't made it to therapy yet? You're exploring your depression and anxiety. You're learning about it, and that is going to help you to manage it. Most colleges have services for mental health. So I would suggest you look into what your school has to offer and take advantage of those programs, because that's what I did. I went to my school counseling center and eventually they referred me to an outside therapist. I believe most schools will do that for you. The suicide rate in college students, we hear about it all the time. It's sad. And I hope that schools are stepping up and doing more to promote their mental health services. Some people think you need to be at some high level of depression or anxiety or have to have some serious life-threatening issue to see a therapist. You can be perfectly fine. You can meet no criteria to be diagnosed with an illness at all and still benefit from therapy. You get an objective ear. You have somebody to talk to, someone to help you uncover different things about yourself that you never knew. And when you are dealing with anxiety and depression, it helps because you talk about these moments and you learn what your triggers are, and you learn how to avoid those triggers and what to do when you can't avoid those triggers. One-on-one help from a professional. You can't beat it. It may be scary to think about opening up to somebody, but everything is confidential. You have nothing to be afraid of. My last tip is specifically for nursing students and medical students. Anyone that has to deal with clinicals where you basically decided you want to cater to other people. But how do you cater to someone else whenever you are feeling so low and down about yourself? So in the moment of these clinicals, when you're dealing with these patients and depression, anxiety, whatever, it's really strong today and you don't know if you can make it through. Take a breath. You can make it through. Use the tips that I have told you. You need to step back sometimes. Step in the bathroom or wherever you need to go to be able to get a little bit of privacy and just breathe in and out. Take some deep breaths. You have to take care of yourself in order to take care of others. And sometimes it gets hard, but you have to find the time for yourself or you will burn out quick. You can do this job with depression and anxiety. I would have never considered nursing for myself. I started off wanting to be a pharmacist. Nurses do spend a lot of time with the patient. I've always known that I'm an introverted person. I didn't think I would fit as a nurse. How does an introvert be a nurse? There was a nursing aide that told me at one of my clinical sites that I seemed too quiet to be a nurse. First of all, everybody's different. Everybody has different characteristics. From being introverted to extroverted is a spectrum, and everyone lies at a different spot in between. And I had come to terms with being an introvert and being a nurse. I have unique capabilities that an extrovert doesn't have. You know, we can all work together. This isn't an extrovert's only job, okay? We're past labels. Segregation will not define us anymore. It will not rule us. we can do whatever we want to do. And I said back to that nursing aide very quickly. I was quick with the comeback. I said, I've met many quiet nurses. And she said, yeah, I guess you're right. I am right, because there is no one type of nurse. You don't need to please anyone. You don't need to fit into any type of box. You can be a nurse with anxiety and depression, and be a good nurse with anxiety and depression, and whatever else you bring to the table. Use those to connect with your patient in different ways that another nurse cannot. You can deal with these issues and be a successful professional. You can't think that one day you're going to wake up and these disorders are going to be gone. They're not. You just have to learn to manage them, learn to function with them, learn to use them, and most of all, accept them, because they're there to stay. That's all I got for you. Thanks for watching. Please like and subscribe to my channel. I have lots of videos coming up next, so you don't want to miss it.